Hi, I'm Josette Saxton, the Mental Health Policy Associate at Texans Care. This session has been a great step forward for kids' mental health, giving us a lot of good things that we can build upon as we go forward to the next session. I think there was a lot of good things that happened, not only for kids that have mental health concerns, but all of our kids, because we know all kids have mental health. One of the things that have happened is that more parents will have access to education in their homes through some home visiting programs that will help them learn about what they can do to promote children's positive development, and that would impact their health, their safety, their emotional development, as well as help them to be better in school. Some of the positive things that came out of the session related to students' mental health were some training bills that will make sure that teachers are better able to identify when kids might be struggling with some mental health concerns and knowing how they can respond to the students in ways that will help them and not make things worse. This is not relying on teachers to thinking that they're going to be able to diagnose or treat the students, but really it's going to help them recognize those red flags that there might be something of concern, and then knowing who they can approach within the school, and then also the students' families, parents, so that they can then figure out how can they help this child. There was also a bill that Texans Care championed that would incorporate mental health prevention into our state's coordinated school health efforts. And really what this does is have the community come together and identify ways to look at the whole child, the health of the whole child, so that students can be successful in school, because we know that a student that is not physically or emotionally well is not going to have the best academic outcomes. So making sure that mental health prevention is part of coordinated school health is going to mean that more kids will be able to stay in school and be good learners. Thanks to Senator Taylor and Representative Coleman, schools will have an easier time identifying effective programs related to positive youth development, mental health prevention, substance abuse prevention, in addition to a list that currently exists already that provides mental health intervention and suicide prevention strategies. This list will also be more readily available to schools as it's posted on more agencies' websites, as well as educational resource centers. And for those kids and families that have the most serious mental health concerns, there were some big wins about how we can better serve them, plan for services, making sure they're getting more than just what we think of as traditional mental health treatment, because we know that kids with mental health concerns that are really struggling, they need more than just we think of as therapy and maybe medication. They need to have the community come around and really build on their strengths and develop a plan that meets their needs. We were very excited to see the state make significant investments into what's known as the YES waiver, which stands for the Youth Empowerment Services Medicaid waiver, which is a program that allows kids with serious mental health concerns that are at risk of being placed outside of their homes, such as hospitalized in a residential treatment center or even the child welfare or juvenile justice system. But it allows them to access services through Medicaid that can help them stay with their families, where we know they do best and they have better outcomes. Another big win this session for kids with serious mental health concerns are the improved program coordination and service coordination that's going to take place thanks to SB 421 by Senator Zaffirini and championed in the House by Representative Naistat. What this bill does is establish the Texas System Care Consortium, which is looking at how the state, across all of its system, can improve services to kids with mental health concerns. Not just the traditional mental health concerns that we may think of, but really looking at what can we do in schools, what can we do in the juvenile justice system, the child welfare system, and how can we better partner with parents, families, and communities to make sure that kids are getting what they need to succeed. One of the most heartbreaking things that I hear about in this work is hearing from families across the state who have a child that has severe mental health concerns, and they're struggling, trying everything that they can do in their power to make sure the child gets the services that they need. Unfortunately, there are times, it's hard to believe and it's hard to hear, but the parents face the decision or they know that they've exhausted all of their options, and in order for their child to receive treatment, that they need to enter either the child welfare system or even the juvenile justice system. Another heartbreaking result of this is parents names are placed on the central registry saying that they are guilty of abuse and neglect, which means that they might not be able to work in certain professions like teaching, social work, or even the police. SB 44 by Senator Zaffirini will begin addressing this problem of parental relinquishment by having state agencies come together and look at what are some of the alternatives that we should be looking at to avoid parents having to come to this decision. In addition to the strategies that are going to be coming out of SB 44, the state has already invested funds so that kids who are identified by the Department of Family and Protective Services as being at risk of parental relinquishment due to unmet mental health needs could instead receive intensive services through the public mental health system. I think what really inspired me this session, what really excited me, was hearing our policymakers, our legislators, and our state agency heads start talking about schools when they're talking about children's mental health. So often when there are policy discussions related to mental health, it's just talking about kids with mental health concerns, kids with mental illness. But no, everybody has mental health needs.